So I'll start with an update and then give a couple of other ideas, or not other ideas, but other tips. And then we'll just go straight to the question and answer part of this. So if we look at our data for this week, not surprisingly, our case count is up. So we currently have almost 41,000 cases of COVID-19 reported in the Roanoke City, Alleghany health districts, with 1,118 reported in the past week. I think it is important to remember or to note that we expect that this is an underreporting as more home kits, testing kits have become available. We expect that there are more people who are positive, but because they're testing positive at home, we may never find out about them through the official channels. So we currently have, again, for the week ending this morning, we have 1,118 new cases of COVID-19 reported, and that's likely an underestimate. If we look at those numbers, about 27,000 are from the Roanoke, are from the Alleghany Health District, and about 14,000 are from the Roanoke City Health District. We continue to see about 15% of our cases in children, so people under the age of 18, and about 45% of our cases are in people under the age of 35. Presumably, the younger population has higher numbers because of the lower rates of vaccination. It's also important for us to continue to stress that the vast majority of our new cases, our hospitalizations, and our deaths occur in people who are not yet vaccinated. So I'll provide those data on the data sheet, but looking at the last week, people who were unvaccinated developed COVID at about 9.5 times the rate as people who were vaccinated. If we look at our hospitalization numbers continue to be at high numbers. So last week reported 105 hospitalizations. This week we're reporting 106 hospitalizations. Of those, 58 are new hospitalizations. 31 of the total hospitalizations are in Roanoke City Health District residents, whereas 75 are in Alleghany Health District residents. If we look at our deaths associated with COVID-19, unfortunately, we continue to see deaths associated with this terrible virus. We currently stand to have lost 727 of our residents. Again, we've lost 727 of our residents to COVID-19. So this virus continues to just devastate our communities. With respect to our vaccinations, it's a mixed bag. We continue to see people get vaccinated, which is fantastic. We're up to about 385,000 vaccines administered in our health districts since the beginning of the vaccine effort. We are continuing to see some people show up for their first doses. The majority of the new vaccinations, however, are occurring in people who are already partly vaccinated, and they're getting either their second shot or most commonly their booster shots. What we know is that while the vaccine is not as effective as we would like it to be, we would like it to be 100% effective. What we do know is that it is effective at decreasing hospitalization rates, decreasing infections, and decreasing deaths associated with COVID-19. And specifically, it's really important for people to get their booster shots. We're seeing that having a booster is protective. So with that, I'll just address a couple of things that I know everyone is aware of. The Centers for Disease Control did change their recommendations for isolation and quarantine. And now people who develop COVID-19 can get out of isolation after day 5 if they are asymptomatic and or recovering, and they don't have fever, of course. Now, it's critically important that if people release themselves from isolation at day 5, that they continue to wear a mask. The vast majority of transmission occurs 1 to 2 days before onset of symptoms, up to 2 to 3 days after onset of symptoms. But there can still be some transmission. So to mitigate that small risk of transmission after day 5, it's critically important that anyone who has COVID, who does return to work or to school, wear a well-fitting mask for a minimum of 5 days after that return. So a total of 10 days, 5 days in isolation, 5 days of wearing a mask. With respect to quarantine, so remember, isolation is for people who have COVID-19. Quarantine is for people who are defined as having close exposure to someone who has COVID-19. If you are fully boosted, you do not need to quarantine. However, if you are not fully boosted, the recommendation is to quarantine. And certainly we would encourage people today to get tested on day 5. And so with that, I will open it up for any questions. Oh, I also, excuse me, wanted to note, we know that there have been some questions about testing capacity. The system is stressed out. We know that the system is stressed out, but we are fortunate that we have free testing events on Tuesdays through January at the Salem Civic Center from 3 p.m. to 5 p.m. So we certainly encourage people to use that as an option if they are interested in getting tested. And with that, I will open it up to questions. I know that was a lot of information.
You can unmute yourself or put a question in the chat.
Dr. Morrow, this is Tom Bird, WFXR. How are we seeing with the flu cases? Is that also taxing the hospitals? And what do you tell people that don't know if they have flu or COVID, how they can tell the difference?
Sure. So that's a great question. And I'm really glad you brought that up. I should have mentioned that earlier, that we are seeing cases of influenza on top of our COVID-19 cases. So it's really difficult to tell the difference between COVID-19 and influenza. And I strongly recommend that people get tested. A lot of places are testing for both. So if you have fever, cough, body aches, and you test negative for COVID at home, it's still important for you to go see your healthcare provider, maybe get a flu test as well. A lot of our healthcare providers are doing dual testing to try to make sure that we're catching everybody, either if they have influenza or if they have COVID-19. So I appreciate that question. Thank you.
Hey, Dr. Morrow, this is Will Thomas with WDBJ7. I just wanted to ask kind of what you would say some of the benefits are of some of these lower isolation number days for. I know we've heard a lot about it kind of can relieve some of the stress on the hospital system. So can you talk to me about some of the benefits of the CDC making the decision to kind of cut that isolation / quarantine time kind of in half?
Yeah, I think that one of the challenges that we've learned over the last 2 years, and it feels like an eternity that we've been dealing with COVID-19, is that COVID-19 has been devastating not only for the people who become ill and those individuals who succumb to this disease, but it's devastating in the impact that it's had on keeping children out of school, keeping people out of work. The economic devastation is profound. And so it's really important for us to balance all of these threats. Over the last 2 years, we've really learned the risks and the benefits of all of our mitigation strategies. We certainly know the risks of the disease, and we're needing to constantly balance that. So if we just look at the last few days and Christmas travel and how many flights were canceled because from what we've heard, I don't have any personal knowledge of this, but what we've heard is that some of those cancellations were because of staffing changes. As we know more every day about this virus and when the most transmission occurs, we need to continually modify our recommendations as our knowledge changes and really as that risk-benefit analysis changes. And so I think that we have to be transparent. If we decrease the isolation and quarantine periods, which we have done, there is a small risk at that tail end that there are people who might transmit the virus. And that's why it's so important for someone who has had COVID and who is going back to work or going back to school, that they wear their masks. If we remember, if we think back to the changing mask recommendations, what we know is that the cloth mask, preferably 3-ply, and certainly there's been a lot of chatter about single-ply cloth masks, which we don't recommend, or the surgical mask, the loose-fitting surgical masks. What we know, not the N95s, what we know about those is that they are somewhat protected. They are somewhat protective for the person who's inhaling. It decreases the large droplets from getting in. But the most important role that they have is to prevent the person who may have COVID from contaminating the environment. Versus the N95, which is those really well-fitted medical masks, that protects the person from inhaling. So those are super protective for the person inhaling. The bottom line is, if people are released from isolation at 5 days and they wear a well-fitting regular mask, not the N95s, they are protecting the people around them. Then the people wearing masks are protecting themselves a little bit. So it's that risk-benefit calculation of the risks are devastating economic impact of this pandemic, with a low risk of transmission. So let's relook at that balance and make sure that we're doing everything that we can to protect all aspects of our society. And again, I want to emphasize that the vast majority of transmission, what we've learned over the last 2 years, looking at different variants, this is a very sneaky virus, is that the vast majority of transmission occurs before symptoms, 1 to 2 days before symptoms, and up to 3 days after symptoms. There may be a very small, low risk of transmission after that, and we're modifying that risk by making sure that people know to wear a mask. Does that, I hope that answers the question. There's a long answer.
Yeah, no, that was great. And that's, where the mask, unvaccinated and vaccinated, is that right?
Yes, and one of the things that I've gotten a lot of questions about is why do people who've been vaccinated still have to isolate when they have COVID? And I think it's so important to remember that vaccination decreases the risk of getting infected. We just saw, looking at the most recent data, that in Virginia, risk of COVID-19 was 9.5 times higher in people who are unvaccinated versus people who are vaccinated. So it prevents infections. Doesn't prevent all infections, but it prevents a lot of infections. It also prevents some hospitalizations. It prevents hospitalization and death associated with it. But if you get infected and you're vaccinated, you still have COVID and you're still transmitting it. So your risk of getting it is much lower. Your risk of hospitalization is much lower. Your risk of dying is much, much lower. But if you get it, you still need to be isolated and you still need to wear your mask for the days 5 through 10, because you still have COVID. Versus quarantine, if you're fully vaccinated, including booster, your risk is so much lower that it's safe for you to be out and about as long as you're wearing your mask.
Thank you.
You're welcome. Thanks, Will. I'm not seeing any questions in the chat.
I've gotten a question from someone who is not in the chat at the moment, and the question is, why has the CDC lowered the is there anything the city is doing to improve accessibility for tests? I believe this person means, is there anything the health department is able to do to improve accessibility for tests?
Yeah, so the one thing that I want to promote is our Tuesday free testing drive-through event at Salem Civic Center. That's Tuesdays 3 to 5 p.m. We only had 23, 24 people show up last week, so we think that that's an underused capacity. And we certainly encourage people who need to get tested to do that. I think that one of the things that we have learned is that the home tests have flown off the shelves. We're certainly looking to other ways to support testing capacity. So our libraries have been able to provide some at-home test kits. Some of our schools have the capacity to do some testing, and so we're constantly looking at the capacity, looking at purchasing our own supplies. It's an ever-evolving situation, as has happened throughout this entire 2 years. This situation continues to evolve, and our approach to it, including our testing approach, continues to evolve. But with respect to what are we doing imminently to address capacity, we've got a test site today, Salem Civic Center, so we encourage people to use that.
Any additional questions?
Dr. Morrow, in the district, can we tell yet if the Omicron is as deadly as, say, the Delta?
We don't have good local information. One of the things that we've talked about in the past, and I think this is an important reminder, is that in order for us to know what circulating strains are in our community, we need to do whole genomic sequencing, which is a lengthy and expensive process. And so we really rely on our VDH guidelines or data, as well as our Centers for Disease Control data. So Centers for Disease Control data released today shows that in Region 4 of Health and Human Services, and we are in Region 4, we're at about 60%, a little under 60% of the circulating strains are associated with Omicron. So we can assume that that is what's happening here in our local district, but we do not do that kind of testing at the local level. There is a question in the chat. Have people been taking advantage of the free testing at Salem Civic Center? A couple weeks ago, we only had 5 people get tested there. Last week, we had, I think it was 25, a little under 25. So we have not exceeded that capacity. We have capacity there, and we encourage people to use that.
With so many people using the home test, is there, as you said at the beginning, there is most likely underreporting. If somebody does take a home test and gets a result, especially positive, should they be reporting those results?
Ideally, they should be reporting those results to us, yes, because then we can provide them with, personalized recommendations in terms of isolation, quarantine, and more importantly, we can continue to have a better understanding of the impact that COVID is having on our community. So we strongly encourage people who test positive on a home kit to let us know. It's also really important to remember that there are limitations to the home kits. It's a wonderful, convenient tool that we have available to us. I think it's fantastic that they are more available now than they have been historically, available in the sense that more places are purchasing them. Unfortunately, the demand has exceeded the supply at this moment, but we also need to remember that with most of the home tests are rapid antigen tests, and antigens for people who are asymptomatic, there is a high false negative rate. So if someone is asymptomatic, a rapid antigen test is not a great test. You might need to repeat it a couple of times to be fully assured that you've captured the situation. If someone is positive, we encourage them to contact their healthcare provider and find out whether they need to get confirmatory testing. We can usually count on a positive. We are less confident in a negative, but if someone is negative and symptomatic, they should talk to their healthcare provider.
All right, hearing no further questions, thank you all for joining us. We'll get this optimized and get the data out to you. If you have anything to follow up with, you can certainly let me know. Thank you, everyone.
Thank you. Happy New Year.